Good afternoon, I'm Haryanto Diman. The number of Omicron cases in Singapore has started to rise sharply, especially in recent days. At a press conference this afternoon, the multi-ministry task force warns that we should prepare for further surges in infections in the weeks ahead, as Omicron is more transmissible than Delta. For the upcoming Chinese New Year period, all current safe management measures will prevail, and individuals are encouraged to exercise caution. The permissible group size for social gatherings remains at 5 persons, and the maximum number of unique visitors per household will remain at 5 per day.
We have not seen the full impact of the Omicron wave in Singapore, and now is not the right time to take a gamble to remove VDS on the hunch that Omicron may be less severe for the infected, unvaccinated. We cannot gamble on the health of Singaporeans.
With high case numbers expected in the coming weeks, the task force recommends that businesses should do everything possible to dampen transmission and minimize operational disruptions. That means preparing their business continuity plans, adhering strictly to safe management measures, and encouraging workers to test themselves regularly. Protocols will also be adjusted to protect Singapore's healthcare capacity. From Monday, January 24th, in-person visits to all hospital wards and residential care homes will be suspended for the next 4 weeks until February 20th. Some patient groups will be allowed one pre-designated visitor with 1 visit per day. Changes to our healthcare protocols as well, given Omicron's shorter infectious period and lower viral load compared with the Delta variant. The task force says the maximum isolation period will be reduced from 10 to 7 days for fully vaccinated people and children below 12. And with immediate effect, children 5 to 11 years old, regardless of their vaccination status, can opt for self-isolation for 72 hours at home, and they can end isolation when negative on a self-administered ART.
We've also rationalized the duration which COVID-19 infected persons need to be isolated within protocols 1 and 2. And this is in line with the shorter period of infectiousness associated with the Omicron variant. In studies conducted by NCID on patients with Omicron infection that were admitted for treatment, most vaccinated persons cleared their viral load over a shorter period of time compared to Delta infections. By the 7th day following infection, the CT values for PCR testing rose to a high level, suggesting that they were no longer infectious. NCID was also unable to culture viruses from samples collected from these patients by that time. The study results have allowed us to refine our isolation protocols and to shorten the maximum duration of isolation for vaccinated persons. So in minimally symptomatic persons who are fully vaccinated, the maximum isolation period will now be shortened from 10 days to 7 days. However, those who are as yet not fully vaccinated will still need to isolate for up to 14 days. And those recovering well may return to normal activities after that initial 72 hours of isolation and after testing negative via the antigen rapid test or ART.
With imported cases now a shrinking proportion of our overall infections, the testing regime under the Vaccinated Travel Lane scheme will be simplified. From this Monday, January 24th, in addition to the usual on-arrival PCR test, all VTL travellers entering Singapore will only need to do unsupervised self-administered ARTs from the 2nd to 7th day of their arrival, if they intend to leave their residence or accommodation, and they must test negative before they can go out. However, they won't be required to submit their results. Travellers who test positive on these ARTs no longer need to undergo a confirmatory PCR test. Instead, if they are well or have a mild condition, they should self-isolate for 72 hours. But that said, those who identify themselves as potentially at risk should visit a doctor, even if they feel well. Also from the 24th, non-VTL travellers who are fully vaccinated and recovered recently from COVID-19 within 90 days of their last infection, they will be exempted from all testing and stay-home notice requirements. That is, if they are able to provide appropriate documentary proof. Non-fully vaccinated, recently recovered travellers will be exempted from pre-departure testing requirements, but will still be subject to all other prevailing border measures. And with effect from March 14th, those aged from 12 to 17 will be required to take their booster doses to retain their fully vaccinated status. From early February, the Health Ministry will progressively send invites to these individuals, starting from those 16 and 17. Visit straitstimes.com for more on today's announcements. You can also watch the full media conference on the Straits Times' YouTube channel. And remember, subscribe by hitting the button below. Now, I'll be discussing these developments with an infectious diseases expert on The Big Story. So see you at 5:30 p.m.